Hi, I'm Rook. I'm a registered nurse at Maimonides Hospital. I work here in the CT ICU, which is the cardiothoracic ICU. We take care of patients immediately after surgery and for the first few days, usually 24 to 48 hours after they have either open heart surgery, also known as bypass surgery, valve replacement, and aortic dissections. I'm currently awaiting a patient from the OR who has been in the operating room since late last night. And I'm told that the patient's going to be very sick, but we take care of sick patients in the ICU. That's what we do here. So get the pulse ox on, put it on this thing. Nurses are very often thought of as angels, but what that deflects from what we do is that we're all college-level educated professionals with a range of critical thinking skills who've had a science background, who then learn how to take care of both people and their illnesses. We have to pull the curtain, protect our patient's privacy. We're going to clean them up and we're going to do some stuff and be out in a minute. So I went in to give the patient some care. We basically turned the patient, post-op patient. He's post-op day one, so one day after surgery. This morning his tube was removed from his mouth, so he was extubated. He's taken off the ventilator. He's doing really well. See, when you break your leg, you get a cast and everyone signs it. Here, when you break your heart, you get a heart and everybody signs it.
I didn't break my heart. You guys broke my heart.
And so we turned him, did some chest physical therapy, help expand his lungs, teach him some breathing and coughing techniques, and change the seats while we were at it. You're currently off the medicine. We'll see how it goes.
Okay.
All right? Do you have your bell in case you need me?
Yes.
So we just got report for a patient. It's not our patient. Another nurse will be admitting that patient, but that nurse is eating right now, and there's no need for her to come out from a break and eat to do the setup. We can all do it because we're all trained to do that. So we're going to put in the basic information about the patient and see what we need based on the information the operating room gave us to set up the equipment we need to take care of this patient when they come out from surgery. So we had a patient come right out of surgery. I was secondarying with Anna, who's my orientee. And the primary nurse hooked up the patient's ECG monitoring so we can tell what the heart rate was, and the arterial line, which we can tell what the blood pressure was. And then I was responsible for the other equipment and checking to make sure everything's attached to the patient and working. My anxiety level now versus when I started 8 years ago. 8 years ago I wore a mask all the time so no one could see me go, oh my God, when my patients came out, because it was nerve-wracking. However, it wasn't so nerve-wracking so that I felt like I was disabled. I felt like by the time I was off orientation at this facility with the people I've worked with, I had the tools I needed to admit my patient, know when there was a problem, and know when to call for help. And that's key. At Maimonides, we have a wonderful preceptor program where the nurses work alongside another nurse from the time they're off classroom orientation to help learn how to admit these patients from surgery and how to care for them. So this time, instead of just connecting, I'm connecting and saying things aloud and directing her in terms of how to do something. You know, patient had a good heart rate, patient had good blood pressure, so we could do things a little slower than we would if I was just doing that alone. So it's definitely a big part of what we do as nurses in CT-ICU. And throughout the hospital, simply because in order to continue having a good pool of nurses to take care of the patients, we have to train them. And the best way to train them is to have them work alongside another nurse whose skills are up to par to teach other nurses. So I'm going to do a primary admission of a patient who just had open heart surgery. This patient has had a dissection of his aorta, and that's been repaired. It was a very long surgery. The patient went in at midnight and is coming out about 4 o'clock in the afternoon. So it's typically a long surgery. This is a little longer. Patient's on a lot of medicine, and we're gonna try to keep him stable, blood pressure, heart rate under control. The physicians will be here, and we'll work alongside to help this patient recover. So for the rest of the day, 7:30, I'll be here in the room with the patient.